Despite being described as one of the most misunderstood conditions, Functional Neurological Disorder, or FND, is the second most prevalent neurological disorder in the UK. This brain network disorder breaks down communication between the brain and the body, with the brain failing to send or receive signals. Symptoms of FND are a mixture of physical, cognitive and sensory dysfunctions and can fluctuate per person. They include difficulty moving or walking, issues with the bowel or bladder, a loss of consciousness, or chronic pain and fatigue. They can be triggered by a range of social, biological and psychological factors. The triggers and symptoms are so varied and confusing that FND is repeatedly misdiagnosed compared to other disorders such as multiple sclerosis, Parkinson's or epilepsy. But with the statistic that a third of people who visit neurology clinics display FND, more needs to be done to raise awareness and knowledge for this critical and life-changing disorder, which is why today marks FND Awareness Day in the UK. Here are some common myths about the condition. Number 1, FND patients either have the disorder or another neurological disorder. In fact, the truth is that FND commonly occurs alongside other neurological conditions, making it even more difficult to diagnose. Number 2, FND symptoms are voluntary actions. In fact, in the truth, FND symptoms cannot be controlled by the individual and are completely involuntary actions. Number 3, the treatment for FND is solely focused on psychological support. The truth is that FND treatment is based on individualized multidisciplinary therapy made up of both physical and psychological support. There is no quick fix to treating FND. However, it is possible to retrain the brain using automatic pathways in the nervous system to minimize and stop symptoms altogether. This allows individuals to regain independence and control of their lives. Treatment will often be that multidisciplinary team of experts who have an understanding of the underlying mechanisms causing FND, their backgrounds, including neurology, psychiatry or psychology, and other AHPs, all able to provide treatment to help diminish symptoms. Our rehabilitation case managers are included in this list of such clinical professionals. Following a traumatic event, when an individual has received life-changing injuries, FND can be triggered. Once our case managers have received a referral on a personal injury case, they complete an initial needs assessment with the injured party to identify their symptoms, both physical and psychological, and to determine the most appropriate treatment and support needed in their rehabilitation. If FND is diagnosed by a specialist consultant, our case managers will then use their clinical knowledge and previous experience to organise and communicate and manage that multidisciplinary team of experts to provide the right care and treatment throughout an individual's rehabilitation. We work with our specialist panel of experts to tailor a rehabilitation solution. Rehabilitation can often be lengthy and complex, so our consistent monitoring and evaluation is critical to ensuring goal-focused outcomes. FND is still largely not known about, but can have detrimental effects to a person's quality of life and their independence. Continuing to raise awareness and understanding of what FND is all about will help to change lives. To find out further information and to discuss how you can get involved in the charity FND Action, there are some interesting webinars on their site providing awareness of FND. You can access them at www.videochat.fndawarenessday.org or scan the QR code. Corporé are committed to helping our case managers develop their knowledge and skills in this important area, and we will be running training events later this year. We're supporting Functional Neurological Disorder Awareness Day. Are you?